Welcome to today's Insight video from the World Wellbeing Movement on employee voice, a key driver of workplace wellbeing. My name is Sarah Cunningham, and I'm one of a number of co-authors of the Work Wellbeing Playbook. And I'm joined here today by fellow co-author, Dr. Cherise Regier. Now, when our research team came together to create this resource, our aim was to democratize access to high-end research insights so that business leaders everywhere are equipped to improve employee well-being at scale. If you're new to this resource, I highly recommend you go to our website, worldwellbeingmovement.org/playbook. There you'll find an introduction to the playbook, and you'll also find a section entitled Getting the Most of this resource. I highly recommend you start there. And if you're still here, that means you want a deep dive on employee voice. So let's start there. First of all, how do we define employee voice? Well, at its core, it's about creating those conditions to enable people to feel heard. So it's all of those formal and informal ways in which employees are able to share their ideas, raise concerns, and participate in decisions that affect their work life. But speaking up is just the beginning. What matters just as much is what leadership do with that information. Because research shows us that when leadership listen, when they respond meaningfully, and when they demonstrate follow-through, employee voice can enhance trust. It can strengthen employees' sense of agency and fairness and influence over their working conditions. These are all, of course, meaningful contributors to our well-being at work. Now, those of you who are familiar with the playbook will know that none of these drivers exist in isolation. There is interrelation between them. So employee voice has connections with trust, with management, with support. And critically, part of trust is psychological safety, i.e. that shared belief that we are free to share our ideas and our critique without fear of recrimination. So with that definition shared, I'm thrilled to hand over to Cherise, who's going to share a little bit more about interventions to improve employee voice.
Thank you, Sarah. So this slide introduces our first key overarching piece of advice that really underpins the remaining interventions. Create multiple communication channels for employee voice. Organizational research shows that when employees are given several avenues to express their thoughts, formal, informal, and confidential, their sense of psychological safety, engagement, and performance can rise quite dramatically. So let's break that down. First is formal channels. These include structured mechanisms like company-wide surveys, town halls, grievance procedures, or engagement with representative bodies. These are important because they demonstrate that the organization is listening in a systematic and transparent way. But informal channels like quick Slack messages, casual conversations, or spontaneous team discussions are equally powerful. These often surface emerging concerns or innovative ideas before they even reach a formal process. And then there's a third category, confidential channels. These are absolutely essential for creating psychological safety. Studies show that when people have a trusted, private way to share sensitive feedback, whether it's about harassment, discrimination, or disclosing a disability, they're far more likely to speak up or to make an informed decision about doing so. In fact, one study found that organizations with credible anonymous reporting systems saw higher levels of perceived fairness and organizational trust overall. So for leaders, the key takeaway here is that no single channel works for every issue. A healthy ecosystem of voice mechanisms, formal, informal, and confidential, ensures employees always have the right route for the right kind of feedback. and that in turn strengthens engagement, innovation, and well-being. So moving on to the next slide, we turn to one of the most widely used and effective tools for amplifying employee voice, the employee survey. When designed thoughtfully and followed by genuine action, surveys are an incredibly powerful, scalable, and cost-effective way to understand how people are experiencing work. They help organizations identify not just the challenges employees face, but also the conditions under which they thrive. But the real takeaway here is what happens after the survey. When leadership listens and acts, the process itself builds trust and engagement. When they don't, it can actually do harm, eroding confidence in the organization's willingness to respond. A great example of this comes from a randomized controlled trial in India involving factory workers. In that study, simply asking workers about their well-being led to a 20% drop in quit rates, even though this happened after a disappointing wage increase. In other words, the act of asking, of giving people a voice, was enough to improve retention and morale. On the other hand, when survey results are ignored, employees notice. A study from Sweden found that when an organization used employee well-being survey results to co-create a concrete action plan, they saw measurable gains in health, productivity, and attendance. It wasn't just about gathering data, it was about visible follow-through. So the takeaway here is that surveys are not just diagnostic tools, they're engagement mechanisms. When organizations act on what they hear, they build a culture of trust, participation, and psychological safety, all of which are foundational to workplace well-being. This slide zooms in on a key question. How do we actually measure employee well-being in a way that drives insight and action? An effective survey doesn't just ask people how they feel, it also explores why they feel that way. That means combining measures of outcomes like stress or satisfaction with measures of the drivers behind those outcomes, such as workload, leadership, support, or recognition. By linking these two levels, feelings and drivers, organizations can pinpoint where interventions will have the greatest impact. For example, if stress levels are high, but the main driver is poor role clarity, that tells us exactly where to focus our resources. This slide also introduces the Work Wellbeing Score, which distills employee experience into 4 key dimensions: job satisfaction, whether people feel content and fulfilled in their work; purpose, whether their work feels meaningful; happiness, whether they feel happy at work most of the time; and stress, how frequently they feel stressed at work. These dimensions form a composite picture of how employees are experiencing their work overall. And because they're standardized, they allow organizations to track progress over time and benchmark across teams and sometimes even industries. So the key takeaway here is that measuring well-being is not a nice to have, it's the foundation for evidence-based management. When organizations collect data on both outcomes and drivers, they move from reactive problem solving to proactive well-being strategy.
Thank you, Cherise. The next intervention we want to look at is around the importance of training people leaders to support work-life integration through meaningful conversations. People leaders play a pivotal role in creating a supportive culture where employees feel comfortable raising personal challenges, whether linked to caring responsibilities, health needs, or other aspects of life that affect how they work. But we shouldn't expect people leaders to take on that responsibility without support. Organizations should equip managers through training that builds the skills to have those supportive, open conversations. The playbook highlights field studies showing that when supervisors receive targeted training in supportive communication, learning how to ask thoughtful questions, listen without judgment, and problem solve together, employees experience less work-family conflict, better health outcomes, and higher job satisfaction, as well as lower turnover intentions. In other words, supporting people leaders to listen empathetically doesn't just help individuals manage work and life, it strengthens the well-being and stability of the whole team. Our next set of interventions focus on how organizations can empower employees to co-create well-being initiatives. The evidence here is compelling. Well-being interventions have a greater and more lasting impact when employees are not just consulted, but are actively involved in shaping and implementing them. Research shows that participatory interventions, so interventions where employees identify challenges and co-develop solutions, lead to higher psychological well-being, greater job satisfaction, and enhanced employee agency. They also drive greater alignment between individual needs and organizational goals. A powerful example comes from Japan, where a large manufacturing company introduced a multifaceted participatory program to tackle workplace stress and mental health concerns. Employees formed work environment improvement teams alongside managers. They used a structured mental health action checklist to assess risks, propose solutions, and track progress. And they ran employee-led planning workshops to design feasible interventions. The result? Significant improvements in self-reported mental health outcomes and a noticeable reduction in job stressors. A similar approach was tested in Finland, where an industrial workplace used an intensive participative work conference. Workers, supervisors, and managers came together in multi-day seminars to openly discuss problems and co-create solutions. The process deliberately flattened hierarchies, giving everyone an equal voice. It led to tangible workplace challenges, better communication, stronger collaboration, and the removal of long-standing barriers between departments. What's powerful about these examples is that they both show how participation builds commitment. When people help to design the solutions, they're more invested in making them work. That sense of shared ownership and mutual accountability doesn't just improve the work environment, it strengthens the fabric of the organization itself.
Now we turn to another powerful expression of employee voice: structured team dialogue for workplace problem solving. Giving employees dedicated time and space to share experiences, analyze challenges, and co-develop solutions can dramatically improve both performance and well-being. These approaches build collaboration, trust, and psychological safety, particularly when leaders take employee-generated ideas seriously and act on them. There are three main models that have been studied in the literature: quality circles, dialogue groups, and employee problem-solving teams. Each uses a slightly different structure, but they all share the same DNA: small groups of employees coming together to identify and solve work-related problems. When implemented well, these groups don't just fix operational issues, they also strengthen communication, deepen engagement, and enhance people's sense of control over their work. Over the next few slides, we'll look at an example of each model, how they work in practice, and what the evidence shows about their impact. Let's start with quality circles, one of the earliest and most widely studied forms of participatory problem solving. In essence, these are small, voluntary groups, usually around 4 to 15 people from the same work area. They meet regularly under a trained or elected leader to identify and address workplace challenges. One study in Iranian emergency departments found that after just 3 months of running quality circles, nurses reported higher motivation, better health, and greater job satisfaction, along with an increased sense of influence over their work environment. It's a great example of how structured dialogue can reduce stress and give people more ownership over their day-to-day work. Similarly, in the US federal Mint, employee led quality circles tackle practical issues like workflow inefficiencies and safety hazards. The outcome? Improved teamwork, communication, and problem solving skills. And again, that key theme of feeling heard and empowered. So, the beauty of quality circles lies in their simplicity. They're low cost, scalable, and highly adaptable to different sectors, from manufacturing to healthcare to public service. On the next slide, we have dialogue groups, which take a slightly different approach. Instead of focusing on technical or operational fixes, these groups create safe spaces for reflection, mutual support, and emotional processing, especially in high stress professional settings. In one 12-month program, physicians met regularly in small, facilitated groups to share experiences, discuss challenges, and co develop ideas for improving the work environment. The results were also striking. Female physicians reported lower emotional exhaustion and higher job satisfaction. Another study with multidisciplinary primary care teams found similar effects. Through structured workshops, teams identified stressors, prioritized issues, and designed actionable improvements to workflow, communication, and role clarity. The outcomes included lower burnout, improved teamwork, and a stronger sense of shared purpose. So while quality circles focus on operational problem solving, dialogue groups tend to go a bit deeper, building emotional connection, resilience, and trust. They help transform workplace culture from one of silent endurance to one of open and shared problem solving. And finally, we have problem solving teams, which take the principles of employee participation and apply them to more complex, often cross functional challenges. These teams are usually diverse groups, cutting across roles or departments, who come together for a fixed period of time to tackle pressing organizational problems using structured, evidence based methods. For example, in two Danish manufacturing firms, a 12-month participatory program improved employees' influence over their work and role clarity while reducing stress and exhaustion. In another, it improved recovery opportunities as well as collaboration. In the United States, a team based program in youth mental health services empowered staff to address systemic barriers to effective service delivery. The results were significant: higher morale, job satisfaction and engagement, and less bureaucratic bottlenecking. In the Netherlands, a 6-month structured intervention among hospital workers led to lower emotional exhaustion, thanks to clearer communication and stronger task support. Across all of these examples, the message is clear. When employees are invited to co own problem solving processes, not just identify issues, but implement solutions, the result is healthier teams, smarter operations, and a more resilient organization. So, across these 4 slides, we've seen a common thread. Giving people structured ways to talk, reflect, and act together creates both human and operational value. Whether it's a quality circle, a dialogue group, or a problem solving team, the outcome is the same: stronger voice, greater trust, enhanced performance, and most importantly, improved well being.
Let's turn to one of the most interesting pieces of new evidence on employee voice. A large scale field experiment in US fulfillment centers, which was published earlier this year by researchers in MIT and Cornell. The researchers worked with a major e commerce company to test what happens when you give frontline workers a structured way to raise issues and solve problems together. They set up health and well-being committees. These were small, mixed groups of employees and supervisors who met regularly to identify concerns, suggest improvements, and carry out small but visible workplace changes. Now, because this was a randomized control trial across 16 sites, the researchers could see clear cause and effect. And what the results showed was a 20% reduction in employee turnover over the following year compared with control sites, with the biggest gains appearing about 6 months after launch. Now, that effect was equivalent to the retention impact of a 1.5% rise in hourly pay, but it was achieved at a fraction of the cost. Though we still, of course, talk about the importance of fair compensation. What I love about this study is that it also explained why this works. So these committees created value in two ways. First, instrumentally, by making concrete improvements that mattered to people's daily work. And second, symbolically, by showing that employees' voices genuinely counted. This isn't just about collecting feedback. This is about participation, respect, and visible action.
This slide looks at one of the more sensitive but vital aspects of employee voice: disclosure. Disclosure is when an employee chooses to share information about a mental health condition or chronic illness with a manager or colleague. It's often a deeply personal decision that sits at the intersection of privacy, stigma, and support. For people living with chronic or episodic conditions such as depression, arthritis, or multiple sclerosis, that decision can be incredibly difficult, and it may need to be revisited over time as circumstances change. A randomized control trial evaluated a tool called Regier, a web-based decision aid that helps employees weigh up whether to disclose a mental health condition at work. This study found that using the tool reduced uncertainty, lowered decisional conflict, and improved mental health outcomes, both for those who choose to disclose and for those who decide not to. The key takeaway was that simply providing structured, supportive guidance can help people feel more in control and less anxious about the process. Building on that evidence, researchers at the Institute for Work and Health in Canada developed a new free tool called Decide. It stands for Decision Support for Communicating About Invisible Disabilities That Are Episodic. Decide extends the approach beyond mental health to include a range of long-term, often invisible conditions. It's fully confidential, available in English and French, and helps employees reflect on their needs, goals, and the potential risks and benefits of disclosure in their specific workplace context. The larger point here is that disclosure is not an individual act. It's a trust event. People will only speak up if they believe their information will be handled respectfully and confidentially. Tools like Decide help employees make thoughtful, informed choices, but they work well in organizations that uphold psychological safety, privacy, and inclusive leadership. So for leaders, the message is simple. By creating the conditions that make disclosure safe, we turn what could be a moment of vulnerability into an expression of trust, one that strengthens well-being, inclusion, and engagement. It's also important to acknowledge that disclosure also includes whistleblowing. It's important that your organization also has a channel to facilitate potential whistleblowing concerns. So, as we've seen across these interventions, from multi-channel communication and leader training to participatory design and decision support tools, employee voice is far more than collecting feedback. It's about creating a culture where people feel safe, heard, and influential in shaping their working lives. When organizations listen and act meaningfully, voice becomes a powerful engine for well-being, trust, and performance. The Work Wellbeing Playbook brings together this evidence base. Every study we've discussed today, and many more that we didn't have time to cover but are included in this resource, are organized by the key drivers of workplace well-being. So as you move forward, I'd encourage you to think of employee voice not as a single initiative, but as a system of listening, responding, and learning. When we embed that system into how we lead and design work, well-being stops being a side project. It becomes a core part of how the organization succeeds.